As a physical therapist, one of the frequent complaints I get from patients is what they think is carpal tunnel syndrome. So that would be, carpal tunnel syndrome is when you have compression of this band in here, and it leaves less space for the median nerve, which controls these fingers, your thumb and two fingers. And people have numbness or tingling or pain, or sometimes even atrophy of the muscle, like it looks flat. That's a true carpal tunnel syndrome. You can test this by going like this and see if that increases the symptoms, or going like this to see if that increases the symptoms. If that isn't really increasing the tingling, then it's possible you have median nerve compression coming through the scalene muscles. So the scalene muscles, you see, this is a sternocleidomastoid. Behind this, right over the collarbone, you'll be able to palpate the scalenes, and you can push kind of hard. This is how you're going to do a trigger point release to get rid of the numbness and tingling in your fingers when it's not true carpal tunnel syndrome. So here you go. I'm compressing over the collarbone, and there's 3 different bands. So the first trigger point release we're going to do is by moving your head up and down as far as you can. Oh, that's tight. From 12 o'clock down to 6 o'clock. And you continue to do this until it no longer feels tight. Up and down. Then we're going to treat the next band where you tilt your head to the side and you move your chin almost like from 10 p.m. to 4 p.m. Your 4 p.m. is your chin, 10 p.m. is your forehead, and you go along that angle. If that doesn't feel particularly tight, then you're going to switch the other direction, where your chin is like 8 p.m. and your forehead is like 2 p.m. This one's really tight on me. I don't have numbness or tingling in my thumb, but I sure do have a tight band of my scalenes right here. So you just keep doing it until it feels less painful. I can't really explain it, but you'll know when it's done. So that's how you can treat your own carpal tunnel at home. And you can tell if you really do need to go to an orthopedic surgeon, or if it's just tight neck from looking down at your phone, having bad posture, you know, everything that we do.